Okay, proceed.
So, good evening, everybody. Good evening, like member. I'm welcoming you for today's evening session. As usual, Sudhir sir will guide you on the first part of the session, and further than that, I will engage you all, and then Murthy sir or Sudhir sir will be talking to you further. Welcoming Sudhir sir to take the session forward.
Thank you, Mr. Anu. Welcoming all of you. Yet another session of elite homeopathic meeting and discussion. No problem. Things are going on smoothly, except this political disturbances. Common man is not worried about it. Research is going on world. No doubt. I don't know how many of you have seen article 3 to 4 days back in Times of India. Chinese scientists have broken the deficiency of the diabetes. How they have done? They have taken a stem cell from the pancreatic glands. A healthy stem cell is taken from the patient, the person, and it is injected into the highly diabetic patient. Highly diabetic. What happened subsequently? Slowly, the patient has become normal. Where he was highly diabetic, depending on many more medicines, he became almost normal. If this invention is properly implemented, there will not be any diabetic at all, except this implementation of this stem cell of the pancreatic into the chronic diabetic patient in his pancreas. So, what a simple thing. Of course, it is a delicate surgery process. See, you can take biopsy of any of the organs outside, but it is very difficult to take biopsy of the internal organs. Picking the skin or picking the particular spot is difficult. Like that, taking a stem cell from the healthy person, from the pancreas, from a healthy person, is a very difficult process, and it is only microsurgery. Of course, it is for the physicians to do their job. Alright. If I come back to our homeopathic learning of Tridosha in homeopathy. Last 2 classes, I told you about the element of air, element of fire, and today I will explain to you about the element of water. Element of water. The third cosmic element operating in the human body is water. Yes, we know what are the first 2 elements? fire and air. Yes. What is called cake off or kappa? Kappa is equal to cold. In Sanskrit they used to discuss only been affected with kappa. They use that kappa word only for cold. The element of water contains in the human organism is of microscopic cold of all varieties. You need, if you are a scientist, you can understand. In scientific laboratories, water is used in a very different forms. Hot water, heavy water, and thin water, and water without some elements. Like that, if the body keeps this water, it's not just like water that is available in the tumbler. It's a different form. It undergoes altogether microscopic, and it is cold of all varieties. Generally, it can show its action. See, it is a nature's gift. Nature has given that. Of these three elements, the two other elements like fire and air cannot be workable without the element of water. Just understand. Even to curb the fire, water is required. So, water controls the fire. So, what is important? A plant will not live without these elements, all these three. It requires water, it requires light, it requires soil, that is fire, air and water. Without water, a plant will go dry. Without air, it cannot grow. And without heat, there will be no coloration of the leaves. You all know, in the trees, there are very big trees are there. We sleep in the night beneath, so that the exchange of the oxygen is expelled through the trees, and it's good for our health. All the elders have said. The element of water is important as a fire and air. The water keeps fire in check, modifies its burning, modifies its power of consumption, maintains integrity of the body. Water also acts as a lubricating agent in the body as much mobile oil in the automobile engine is required. Location of water. Element of water is located in the chest, stomach, head, throat, joints and fat. Why fat? Then only when your metabolism has to take place, fat is used, exhausted with the fire and with the help of water. Combustion takes place. Stomach is a special seat of water. There are 5 kinds of water like that as air and fire. What are they? First kind is chloraka, moisture. It resides in the stomach and increases the power of water in other parts of the body. Its chief functions is to help digestion by moisturizing the disintegrated food that is assimilated with the acid, stomach acids. Second one is avalambika. It is a supporter. It protects all joints, enables the heat to perform the duty, enables the heart to perform duty with the help of the juices derived from assimilated food. That is energy that is stored in the bloodstream coming to the bloodstream from lymphatic stream to converted to bloodstream whenever it is required and it is used. Then third kind of water is, it's only pertained to human body, not outside. These 5 kinds is called only in the human body. Bodhaka, feeler. The third kind of water is located in the throat and at the foot of the tongue. It imparts the power of taste to the tongue. If it is dry, tongue is dry or throat is dry, you cannot feel the taste. Then fourth kind of water in the body, tapaka, it is the pleasing. Located in the head, it helps the functions of the eye, ears and nose. That's why it is termed as pleasing, because all the sensory organs are working for our health. Then Slasmaka, Slasmaka, plum. The fifth kind of water source is located in the joints and keep them integrated. With this water, movements of different limbs take place without dislocating the bones. So how nature has given us the power to function. Aggravations of water. Naturally aggravated in the winter, spring and in the mornings and in the evening. See, you yourself can feel it. When summer comes in, you feel dryness all over the body because more heat attacks the body, more evaporation takes place, more sweat goes in. So, summer there is a dryness. So, winter you take more water to normal intake. Whereas in the winter, there is more chillness, more coolness outside. So, whatever the water is within the body, that gets disturbed. because it cannot be expelled. In summer you can go by way of sweating as well as urination. Whereas in the winter, no doubt you get more frequent urines. Understand? But that's the only way. And in most of the places in western countries, when the winter comes in, people won't come out. So there is no activity except within the house. You have more warm clothing, etc. It is aggravated by sleep in the daytime, want of physical exercise and the sedentary habits, by excessive sweets, sour and saline foods. Aggravated by excessive sweet, sour and saline food. Some may take more salt food. Some may take more acidic foods. Some may take more sweets. So this excessive quantity that is more than required by the body gets aggravated. Functional aggravation. The excessive use of curds, ice, cakes, milk, sugar, molasses, meat and living in watery places. This is important. There are marshy lands, seashores, riverbeds, or you are working in a factory where water is being used in the different plants, etc. Use of contrary foods at the same time and eating before the previous food has been digested. This we all know. Like give 4 hours time, only then the food in the stomach gets evacuated and pushed into the intestine. So, taking frequent foods aggravates the element of water. Aggravated water causes loss of appetite, drowsiness, heaviness, silly feeling, dropsy, with coating of the tongue, small boils, excessive sleep and sweat, taste, sour, sweet taste of the mouth, Yes. The element of water becomes deficient in the human system. Different and contrary sets symptoms of manifested death. What are they? Dullness in the salivation, loss of strength, indigestion, goiter, excessive fat, urticaria, whiteness of the cornea, white urine, white stools, constipation is also one of the results of the aggravated water. Classification of water. The element of water is classified by foods such as hard foods, pungent foods, bitter foods, astringent foods and dry food. It is also ameliorated by keeping late hours at night, drinking old wines, taking hot bath, exercise, fasting and smoking. Ancient words, they say, honey and emetics are the best means pacifying the element of water. Yes. What are the treatment for the water deficiency or excessive acidity? A person with water element predominates in his system is a patient, stout, strong, beautiful, self-controlled, forgiving, unselfishness, undullness. If the water element predominate in the body, his hair is curly, black, and his eyes are white, etc. His voice resembles the rumbling clouds, the roar of lion, the sound of a drum that is very clear and very high. His limbs are proportionate and symmetric. His eyes show red tinge at the corneas. Red tinge at the cornea. And he does not perspire because there is a moderate heat in the body. He helps much and takes much rest. That is, he works more and takes more rest. And has a fondness for hard, pungent, bitter things. What are the bitter things? That is sour food, that is more pulip, we call it in Tamil pulip, or more acidic. He is steady and constant in his friendship and is conversating with the nature. He moves with nature, helps the nature, tries to understand the nature. That means he is a body constituting harmoniously. In other words, talking homeopathically, his vital force is very normal, very efficient, very good. That is why the harmonious conditions prevail. So, water is predominantly, it must be in its condition. The conditions, water temperament person can be compared to lion, a horse, elephant, a bull or swine. He is such a strengthy person, strong person. Once he reaches his decision, it is very difficult to change. We call it in our language, he is adamant person. He doesn't hear others like he is also a sedate nature, sustaining pain and fatigue better than any other person. He also becomes weak. He becomes fatigued, but better than others. He can regain it constantly, quickly, etc., by taking some necessities, by taking lukewarm water or water. If it is in a very cold region, lukewarm water, and in the ordinary regions or in the summer time, normal water, not ice water, or hot cooled water. He has got a gifts after due deliberate philosophy, enjoys a long life. So, water has to maintain balance in the body. This all gives us an import of understanding that water, if it is properly maintained or function in the body, you are the very healthiest person. You can say you are living for 100 years or 150 years as it is. Of course, there are other things I can tell you, but the elements of air has got 80 disturbances in the body. element of fire has got 40, not 40 disturbances in the body. The element of water has got only 20 disturbances in the body. This itself is to reveal if the proper level of water is maintained in the body, you will be the most healthiest person than any other person. Even if your health is deranged, you will be the first person to be convalescing or recovering than others. So thank you very much. And pass it on to Mr. Anup Kumar. Sir, I have worked 5 minutes. Thank you very much.
No problem, sir. Thank you, sir. Today we will discuss hypertension. That is something which all of us should know. Last week we spoke about cholesterol. Cholesterol will be repeated again because last week many people did not attend. So today we will talk about hypertension, blood pressure, and we will discuss the homeopathic methods of handling it also. So blood pressure we know. Everybody knows what is blood pressure, but do not know how does it what is the real cause of it and how does blood get pressure. So we will just talk briefly about some behaviors of blood, and then we will go to the cause of the problem. So blood, we all know, it's a transport fluid. It's a fluid that transports oxygen and nutrients from cells, nutrients to the cells, and oxygen and nutrients to the cells, and carries away carbon dioxide and other waste products from the cells to the proper areas to get it disposed. Technically, blood is transport liquid pumped by the heart to all parts of the body. So heart is the pump where this liquid is being pushed out of the and circulated. Heart is the pump and blood is the transport fluid. And then this, after reaching every cells, it will be returning back to the heart again for pumping, for purification and then reutilization. So it is just a routine process of pumping and recirculation. So blood is a transport fluid. So it transports, blood is transported to the kidney to remove all the unwanted materials which is floating or dissolved in the blood plasma. It transports oxygenated blood in the lungs. When we inhale and the oxygen exchange happens in the alveoli, it carries a lot of oxygen. The hemoglobin absorbs a lot of oxygen, and this oxygenated blood is then transported to all parts of the cells to get them energies, to allow them to have the individual combustions and get oxygen to the cells. And then it transports hormones from where the hormones, all these endocrine glands makes hormones. They are located in many places in the body. So from there, the hormones are collected and then transported to the location where it is required. So it transports hormones also. Then it transports oxygen to the muscles, and it transports absorbed fluid from the villi of the intestine. Yeah, somebody's mic is on, so please mute it, sir. So the transport waste from the kidneys and the lungs to be removed from the system. The lungs, the waste is being removed, the carbon dioxide is removed from the lungs, and also excess moisture is removed from the lungs. And then this kidneys will remove the dissolved materials, as I said, in the plasma, blood plasma. So blood delivers immune cells also. There are immune cells which is developed in certain areas of the body. From there, the cells are being transported to the areas where there is infections or some sort of invasions by foreign organisms. So it delivers immune cells also. So blood has a lot of functions to perform. So we have already discussed blood earlier. So just this is a brief introduction about blood. So now, it is both a fluid and a tissue. Blood is a tissue. It's a part of the connective tissue, and it's called a tissue because it's a collection of cellular cells, specialized cells, and they serve a particular function, and that is why it's called as a tissue. The cells are suspended in a liquid matrix that is called plasma, which makes the blood fluid. If blood flow ceases, imagine a situation where the blood is not flowing, then definitely that area will die. That is why if there is poor circulation, we have pains because the body part is crying for circulation, and if circulation stops there, that part dies. Or if the circulation totally stops, the brain dies immediately with the lack of all the air and nutrients, whatever it needs continuously. So when the blood circulation stops, we normally die. So now we will see how much blood an average human being will have in this system. An average human being has at least 4.5 to 5 liters, 5.5 liters of blood in their body. So total blood in the body is maximum 4.5 liter to 5.5 liters in normal human body. However, the amount of blood in a person's body depends on several factors, including the size of the person. If the person is a huge 7-footer or a huge person, his blood quantity can be little more than the normal people, and if he is heavy also, then the blood quantity can be more. And if the person is small, the blood vessels, the blood quantity what he is holding in the body can be small, lesser. And if for a newborn baby, you can say it is just lesser than 200 ml. So, the quantity is very small. The baby body is very small, so the blood is very small. The quantity of the blood is very small. And as we grow older, the blood volume decreases, and that is why many people will have problems also. But the blood volume decreases when we grow old. So these are the reasons the blood volumes are reducing also. Now, how much of blood is pumped out at each heartbeat? So this is an important thing to know. Just to know, it will not make any technical difference for you. Just to know, for knowing sake, you should know that the amount of blood that is pumped out of the heart at each beat is called the stroke volume. So what is the stroke volume of an individual? A normal adult will have 5.55 to 80 milliliters of blood is pumped by the heart outside the body. So that is the stroke volume, and which will be almost 1/3 of the cup. For children, the stroke volume is about 25 to 85 ml per beat. So this is the stroke volume, and the amount of blood pumped by the heart per minute is called the cardiac output. So cardiac output is calculated by multiplying the stroke volume by the heart rate. So, for example, if the heart rate is 60 beats per minute and the stroke volume is 80 ml, then the cardiac output will be almost 5 liters per minute. The amount of blood the heart pumps increases with exercise. That we all know. When we exercise, do aerobic exercise and do anything, the heart beats vigorously and faster. So, for example, during maximum aerobic exercise, the cardiac output of young men may increase up to 22 liters per minute. So you can see normally it can be 5 liters per minute, but when you are doing exercise, it can even rise up to 22 liters per minute. So that much the heart can take the variations. Knowing how much blood the heart pumps can help the doctors to make diagnosis and determine if the treatment is working. So when there is any treatments done, and if the heart volume, the stroke volume, the heart pumps is working properly by measuring the heart the volumes pumped out, they can know that the person is recovering from the problems. So we will see that. So now we will talk about blood pressure. This is the topic what we are going to discuss now. And what is blood pressure? So blood pressure is the measure of the force blood pushes against the wall of the arteries as it circulates through the body. So when the blood is pumped into the arteries, the blood will exert some pressure onto the walls of the arteries, and this pressure is called the blood pressure. It is measured by an instrument called sphygmomanometer. We all call it BP meter. So it's called sphygmomanometer, which indirectly measures the arterial pressure by counterbalancing the air what we put on that, and the mercury is balanced against the volume of air, the air pressure, and this is expressed in millimeters of mercury, which this displaces. So we will see how sphygmomanometer works. So this is the sphygmomanometer, the traditional one, which is not used commonly in these days. Now modern things have taken charge, where the mercury ones are vanishing, but this one is very accurate and we can get perfect measurements out of this mercury sphygmomanometer. Now, without mercury, we have these sort of the digital variety. This is the battery operated varieties, and this also will show approximate the accurate volumes or the blood pressures, and both this and the previous one will require a stethoscope to balance the pressure, to hear to arrive at the correct pressure with the blood pressure. So now the latest one is this digital sphygmomanometer, which requires just connection, and it automatically does all the things, and it will show you the blood pressure reading. The two readings are normally shown, so we will see what are the two readings. The blood pressure readings consist of two values. A systolic pressure, that is the top number, what is 120, 80 and all. So this top number is the systolic pressure, the pressure of the heart beats when the heart is compressing. That is the pressure of the blood has, and that's called the systolic blood pressure. The diastolic blood pressure is the bottom number, pressure between the heartbeats when the heart actually relaxes the time. So that is the pressure when the heart is not beating. So the systolic pressure and the diastolic pressure commonly is written together as like the normal blood pressure range, we said, like 120, 80 or 90, 60 or whatever. The systolic pressure will become 92, is normally from 90 to 120, which is normal depending on the person, and diastolic will be 60 to 80 normally. So these are the blood pressure readings. Now, what is hypertension then? Hypertension is the high blood pressure. Is a condition when the blood pressure constantly exceeds 130 by 80. 130 is the systolic, 80 is the diastolic. So when the systolic is higher than 130, in the American Heart Association definition, they say 130 to 80 is high blood pressure. Above that, above 130 to 80 is high blood pressure. But the World Health Organization says 140 by 90 is the above 140 by 90 is called high blood pressure. So anyway, we will know what to follow. So this is the higher when the pressure readings are constantly above the stipulated readings. It's called high blood pressure or hypertension. So hypertension develops when the cardiovascular system faces increased resistance from the narrowed artery. This is the key point which all of you should know. The heart beats the regular way it has been beating from the day one, but the problem starts when the cardiovascular system faces increased resistance. The heart faces resistance from the blood vessels, that is arteries, which has become narrow, and also known as vascular resistance, causing the heart to work harder to pump blood. So when there is resistance, then force will be more, and this force is being expressed in the level of higher blood pressure. The factors that contributes to higher blood pressure, higher hypertension is it can be genetic. Some people will have genetically their blood pressure in their system. Their age, when people go older, then there is a tendency from 120, 80 or whatever the normal things are. Their tendency is to go for 140 or something like this. It's by age. Obesity, if you are too fat, then the chances are there for blood pressure to rise. Physical inactivity. So if you are having a sedentary life, physically you are inactive, then also your arteries will be clogged, and then the blood pressure can increase. Smoking will also cause the blood vessels to contract, and then high blood pressure will be there. Taking high sodium items like salted preserves and salted chips and salted pickles and all those things in the high volumes, and taking too much of sodium chloride, the common salt, then you have a problem definitely waiting for you. Then taking low potassium intake. So if you don't eat potassium at all or low potassium foods, then also you have problems. Then if you are stressed up all the time, you are having you have a sleep disorders, that also will be one of the cause of this high blood pressure. So as the pressure increases, we will see physiological changes in hypertension. What is the physiological changes in the hypertension? As the blood pressure increases, the following physiological changes occur. Cardiovascular changes, the arterial stiffening arteries become less flexible and increasing pressure. So when the arteries are stiffened, becomes harder and not accommodative, then it is not flexible, then the pressure increases. Vasoconstriction, that is, I told about smoking. So vasoconstriction, the blood vessels constrict. So blood vessels become narrow, reducing the blood flow, and then cardiac hypertrophy. So the muscles thicken, the heart muscles, if it is thickened, then it will have more power to push the blood out. So that will increase the workload. So that will be cardiac hypertrophy, and that will also increase the blood pressure. Increased cardiac output. So if the volume of the heart is big, and if the heart starts pumping more blood outside, then also the pressure can increase. Then the other changes in the kidneys. The renal changes will be high blood pressure can damage kidney blood vessels. The blood vessels in the kidneys can break because of the glomerulus has tiny capillaries, which is really filtering the blood which is passing through that, and if the pressure is too high, the capillaries can rupture and the kidneys can get damaged. So that is one reason. Next thing is the kidney will retain sodium. Instead of removing sodium, the kidney retains excess sodium, increasing the fluid volume. So in the blood vessels, the solid the sodium quantity will be retained and will be high. That also will retain. That will also be the cause of high blood pressure. Next is neurological changes. The sympathetic nervous system activation will be there. That increased heart rate and blood pressure. So sympathetic nervous system activation. That is because of this neurological changes. That means the heart, the pumping, the palpitation, everything increases, and the blood pressure also increases. When endothelial dysfunction, blood vessels lose the ability to relax. So blood vessels will be constricted and not relaxed. So it will not allow the blood to flow in. So that the resistance will be there, and that will be the change which will cause the blood pressure. Next is what will happen if you don't treat hypertension. If you don't treat hypertension, you are having a very great chance to have heart attack, maybe a stroke. The kidney diseases definitely can be there. Peripheral artery diseases will be there. Vision problems, the blood vessels inside the eyes can break and you will lose your sight. Then cognitive impairment, because of the pressure, the parts of certain areas in the brain can also get damaged, and your memories and everything can go wrong. So cognitive impairment also will be there because of untreated hypertension. Next is how to manage the hypertension. The normal easiest way is to do lifestyle modification, that is do regular exercise, balance the diet, then stress reduction, we have to do meditation and some other relaxing techniques. Then sleep management, you have to sleep properly the required number of hours, and you have to stop smoking. That is the lifestyle modifications. Then we can take allopathic medicines are there which will cause the proper urine formation, that's diuretics. There are beta blockers, then ACE inhibitors are there. These are all technical terms which the allopathics will know, and calcium channel blockers. So these are the medicines are given by allopathics, whereas we will have our own medication system in homeopathy. So we will see what homeopathy does and how homeopathy will decide which medicine to take. So homeopathy treats the high blood pressure effectively with medicines that are selected on the basis of characteristic symptoms of the patient and common symptoms of the condition. Such medicines are called constitutional medicines and is decided after taking detailed history of symptoms, physical examination, and various diagnostic tests as a part of case taking. So case taking is important to decide on the medicine. So hypertension or high blood pressure is in common parlance is caused by irregular blood circulation. So blood circulation will be irregular because of the limitations the blood vessels are creating to the flow of the heart, flow of the blood. People with stressful lifestyles have to keep their blood pressure levels under control always. People who have stress, they should who have a stress to life, they have to manage their blood pressure, check their blood pressure values so that they will not end up into terms of stroke or cardiac diseases and all. So stress is an important thing to be remembered, and we have to check our blood pressure timely. So now we all know Aconite. Aconite is a wonderful medicine for various things, and here again for blood pressure, which is of sudden rise. There are certain high blood pressure conditions have sudden outbursts. Sometimes it happens all of a sudden, the BP rises. For such people, Aconite works. It inflicts fear of dying and acute anxiety disorder. So they have anxiety and they feel they are about to die, such feelings. Homeopathic medicines, Aconitum is very useful in such situations. So Aconite is a very useful medicine for many things, and here again for sudden outbursts of blood pressure, we have Aconite. Amyl nitrosum. Amyl nitrosum is a very good homeopathic medicine for blood pressure. It reduces the just by inhaling the drug itself, it works. It rapidly dilates all arterioles and capillaries, producing flushing of the face, heat and throbbing in the head by reducing the blood pressure. So it immediately sends flush of blood into the constricted areas, and it dilates the blood vessels, and that way pressure is brought down. Then superficial arterial hyperemia will be reduced. Palpitation of the heart and similar conditions are readily cured by it, especially the flushing and other discomforts of climatic stages. The people, the menopausal aged ladies, people who are going through menopause, they will have hot flashes. For them also, this amyl nitrosum will be a good medicine. Immediately it brings the relaxation for these hot flashes, and even hiccups and yawning, everything, because there is more that the vessels are enlarged, then the yawning also will stop. Often it relieves, it often relieves temporarily even epileptics, even the fixed area, and sickness also will be controlled because of the anyway the blood circulation happens properly. So that works. It's a wonderful medicine for blood pressure. Next is arginum nitricum. It is at times of high blood pressure due to anxiety and mental agitations. This arginum nitricum works, and it is effective to curing the blood pressure because of sudden anxiety and mental agitations. Then arsenic album, our all-time remedy, is very useful for treating high blood pressure resulting from chronic mental stress, anxiety and worries. Other associated symptoms which for this remedy include excess fear, anxiety and depression. So excess fear, anxiety and depression and BP will call for this medicine. Extreme restlessness of the mind to the extent that the person cannot rest in one place, even have panic attacks, especially at night. So that person, again arsenic album. So pain in the head with burning sensation and excessive restlessness along with BP will be arsenic album. Extreme weakness with an ability to move in a degree significantly higher than the severity of the disease. So you can even just turn from one side to another. That will also be arsenic album. The remedy works for patients who use tobacco and alcohols, for patients who desire to drink cold water in small frequent sips. So cold water not in a full gulp, little by little, because heat will be worsening his condition. So again here, worse by heat and lying down. Due to fear of suffocation, he will not feel comfortable lying down. Cold food and drinks. Heat gives general relief, except in the headache, which is here we said heat will be worse, but the headache will be better, which is better with cold application for some time. So when he is having headache, heat again gives relief only with cold application. Then argentum metallicum, aurum metallicum, that is gold aurum metallicum, is indicated for high blood pressure resulting from damage to the arterial walls, causing narrowing of the passage of the blood flow. So the arterial walls are damaged and narrowed. So then this aurum metallicum works. This makes the pulse weak because the arteries are not flexible to pulsate. So the pulse will be weak and rapid and irregular. Sometimes it will be rapid and irregular. This remedy is suitable for patients who experience symptoms like pain in the chest while lying down at night. So when you lie down, you will have chest pain, Then sensation in the heart stop beating and then start beating suddenly with a heart blow. So people who feel like the heart beats for some time, stops for some time, and then starts again. Such people, then severe pain in the head at night that sometimes radiate towards the face. Occasional throbbing of blood vessel is visible in the temples and necks. So the side of the head and even the neck area, you'll feel the palpitations, throbbings, and there is marked congestion in the head which increases after exertion. So the congestion of the head increases after exertion. Patient is better with warmth. They are usually oversensitive and depressed with desire to commit suicide. So aurum metallicum is an anti-suicidal tendency medicine also. So again, blood pressure also will be controlled by aurum metallicum. Gravita muriaticum. Gravita muriaticum, this remedy is helpful for high blood pressure resulting from the narrow arteries occurring due to cholesterol deposits. So arteriosclerosis, gravita muriaticum. A person who benefits from this remedy generally exhibits the following symptoms. He will has high systolic pressure in comparison to the diastolic pressure. So it will be 140 or 150, and then 80 will be the diastolic can be normal, then like 80. But the systolic can go up to 140, 150 like that. So that is high systolic pressure. Headache and heaviness in the head and dizziness, etc. will be different. Remedy is generally more useful for older people suffering from hypertension. So the people of our age group, it's better to remember this medicine, and if the symptoms standing, then remember this medicine. It will be very useful for BP patients who are in our group. Cretaceous, this is a cardiac medicine which all of us know. This remedy is indicated for high blood pressure resulting from irregular beating of the heart. The pulse of the patient is fast and irregular. Patients who are advised to take this remedy also have symptoms which include severe weaknesses and pulse was weak and weak functioning of the heart. Weakness with the slightest exertion which leads to difficulty in breathing even. The pain in the left side of the chest and sometimes on the back of the head. Swelling and chilly feeling all over the body. Better by exposure to fresh air. After taking rest by staying calm, you'll be feeling better. And worse with anxiety and excitement. So everything like the person is overall weak because of this poor heartbeat and weak heart. So tetanus is very important medicine. Now is Blunoin. Blunoin, we know it is a medicine for sunstroke, and so now again, if the blood pressure is shooting high because of sudden exposure to sun, and severe headache is there with throbbing of the blood vessels in the head and that are visible to naked eye, throbbing sensation all over the body. There was a rush of blood towards the head and with a feeling as if the brain is full of blood. So such patients, Blunoin is important. Pain in the head which gets aggravated by lying down on a pillow and if the pillow's heat, if the headache is increasing, again Blunoin. Slightest movement increases the headache significantly. Patients may experience complaints similar to sunstroke. So when you have sunstroke, there are certain symptoms that are similar symptoms in different here. Headache which occurs, which causes confusion with a tendency to forget familiar places. Patients feel better by uncovering their head. So you have a tendency to forget familiar places also. They won't even know where they are. So such confusions and all will be there. For them also, after this sun exposure and they have a blood pressure, Blunoin is very important. Ignitia, homeopathic remedy is very useful. This homeopathic remedy is very useful for treating blood pressure caused by emotional upsurges, relief and trauma. So some grief which is causing blood pressure and traumatic conditions what has been experienced by the person, and with a sudden blood pressure rise, Ignitia helps to bring it down very well. And next is lechosis. Certain bodily changes rest in high blood pressure, result in high blood pressure. That is when there is menopausal stages in the women, their blood pressure can rise high, and lechosis will help them during and high blood pressure comes become a common cause for concomitant for the babies or with menopausal symptoms. Lechosis is used to treat such condition of high blood pressure. So lechosis is an important medicine for ladies of the menopausal ages with these sort of symptoms. Natrum muriaticum. Natrum muriaticum is our common salt. The headache due to high blood pressure is the chief indication of this remedy. So headache because of blood pressure. and is one of the important remedies, symptoms of this medicine, with this retinol, and it serves, there is severe throbbing headache and sensation as if 1,000 hammers are hitting onto the head. This remedy is for certain high blood pressures containing blood pressure conditions which arise due to suppressed anger and stress. So there are people who are suppressing their anger and stress, and they have headache and blood pressure. They have Natmur is the best medicine. Natmur, having events of the past, they will be simply thinking and ruling on the old past events, and the unsolved issues can induce heightened blood pressure levels. So for them, they were brooding on the past and worrying about this as the pressure high rises. For them, Natmur is the best medicine. This remedy is suitable for patients who are having the following associated symptoms like increased heartbeat with irregular pulse. Heartbeats are extremely severe and they are caused shaking the entire body. So every heartbeat will make the patient shake. That much will be the feeling of the patient. So then, for them, Natmur is an important medicine. Then they will have edema, a strong desire for taking salt, the common salt. Then the tongue is coated with a map type of impression. So they will be having a map type, white map type of mark on their tongues. Extreme sensitivity to high sensitivity, they will be very sensitive. High sense of responsibility towards one's duties. They may be very studious and responsible for their work, and being offended easily and feel depression or sadness. They feel easily depressed or sad. Worse from exposure to sun, warmth, and lying down and yawns also will irritate them too much. Better in open air and by skipping meals. If they don't eat food, they may feel better. Application of pressure on lying down on the right side on will be making them feel better. Next medicine is Passiflora. This remedy is having a quietening effect on the nervous system. So it will pacify the nervous system and reducing the anxiety and help to reduce the hypertension progressively. So it will be controlling the blood pressure by controlling the anxiety. Next is phosphorus. This remedy is indicated for blood pressure occurring due to fat deposition in the heart. So heart has fat deposits. For them, phosphorus is important. This medicine helps in treating patients with the following symptoms: long-standing headache resulting in chronic high blood pressure, sudden increase in the blood pressure with results of bleeding from the nose. So suddenly the pressure can be too high, the nose will be bleeding. Damage to the blood vessels of the eye, that is the eye, the retinal, the arteries and all can break, and because of high blood pressure. So for them also, phosphorus can be better, so that further damage will not happen. Increased sensitivity to the surrounding environment such as lightning, thunder, storms and emotional stress. They won't be able to tolerate all those sudden things. Their pressure shoots up. Frequent desire to drink aerated drinks. Worsen from exertions like climbing stairs. Mental stress, lying on the left side. Thunderstorms, everything will worsen their condition. Better by rest and lying down on the right side, and when they are in the open air. Rauwolfia serpentina. This remedy can help us to reduce high blood pressure, restlessness and sleeplessness. It helps to calm the nervous system and reduce the anxiety. It can alleviate the symptoms like irregular heartbeat, increased emotional excitability, irritating conditions of the central nervous system and restlessness. It helps to relax the blood vessels by reducing the noradrenaline, by reducing the noradrenaline from the artery walls and improves the blood flow. So Rauwolfia serpentina is always used for blood pressure treatment, and this is how it works. Viratum viridi. This is an important medicine. It is found that it induces the fall of both systolic and diastolic blood pressure quickly when administered in smaller potencies. So lower potencies, this Viratum viridi works well, helps in reducing the arterial tension and normalize the cardiac palpitation. So Viratum viridi also to be remembered for quick results for reducing the blood pressure, the high blood pressure. Vesicum album. This homeopathic remedy is used for treating high blood pressure resulting from the thickening of the heart muscles. Hypertrophy of the heart and the defect of the heart valve. So valvular disease also, which causes blood pressure. For vesicum album is to be remembered. Patients experience the following symptoms like difficulty in breathing, especially by sleeping on the left side, and during movements. For them, this medicine has to be remembered. A sensation of weight in the region of the heart, swelling of the legs. These are the symptoms. Then there are some less common medicines which also supports the treating hypertension. That is actia resinosa, hypertension with headache and dizziness. Then gensenium, hypertension with fatigue and weakness. So the gensenium will be for weakness and fatigue. So hypertension also get cured with that. Hypertension due to headache with the following conditions. Headache and pressure goes high, Naxomica will help. Anxiety and the BP goes high, along with the aconite and all. Califos also will work. Palpitation and this is heart related. So palpitation due to heart related causes. Digitalis and cactuses work. Fluid retention, rapis men in the like fluid retention in the body, in the heliboros and bryonia. So these are the medicines when there is fluid retention in the body. Stress related BP, arnica works. Kidney related terebinth also supports. Arteriosclerosis, Beretta carb also supports. So this is the end of our discussion on this time, and I think all of you have made use of the information what we discussed now, and let us hand over the thing to Mr. Dr. Murthy. But sir, thank you. I have completed this.
Thank you, sir. Thank you, sir. Suresh Kumar.
Thank you, sir.
Suresh sir. Suresh sir is there?
He's there anyway. He's there.
Namaste, my dear homeopaths.
He's come here.
Okay. Suresh sir, you can take.
Murthy sir, ನೀವು ಇರ್ತೀರಿ
ಇಲ್ಲ ನಾ ಇರ್ತೀರ ನಿಂಗೆ ಇಡಿಲ್ಲ ನಿಂಗೆ ಇಡಿಲ್ಲ.
Okay. We will continue with the therapeutic index, which last we left. From there we will continue.
Yes, sir.
And then the next disease status we will take up. It is dyspepsia. Dyspepsia is a difficult we can say discomforts in digestive tract, and which is indicated by stomach ache, upper abdomen fullness, heartburn, bloating during and after and before the meals. So this is a dyspeptic situation. Otherwise we call it as a impaired digestion. So it can be also termed as impaired digestion. So basically it's the discomforts in the digestive tract. What are the head remedies for the dyspepsia? It is Naxomica, Carbonates, Lycopodium, China, then Aethusa, Robinia, and Anacardium. So these are some of the first line of remedies for the dyspeptic situation. I repeat, is Naxomica, Carbonates, Lycopodium, China, Aethusa, Robinia, and Anacardium. So these are the remedies indicated for the dyspeptic situation. Then next is dysphagia. Dysphagia is the difficulty in swallowing either food or liquid, which is arising from the throat or esophagus. It may be on account of the blockage in the throat or difficult medical conditions arising from brain disorders or muscular disorders, or it may be a nerve disorder also. So is a difficulty in swallowing either liquid item or solid item is known as dysphagia. So what are the remedies indicate for the dysphagia? If the remedies important is your belladonna, lacasis, mud salt, and Lassa And the new remedy is which we have not talked about this. It is known as curare. Curare is meant for nervous system disabilities. So it is basically is for the respiratory tract, muscular atrophies, etc. But it is also used for nervous system also. So lachesis, belladonna, Moxol, NASA and curare are some of the first line of defense remedies for dysphagic conditions. The next instance is dyspnea. What is dyspnea? It is we can call it as a labored breathing or difficult breathing. Difficult breathing or the labored breathing is known as dyspnea. The cause may be lying in the heart or in the lungs. The causative factor may be both in the lungs or the heart. Also, it may be on account of due to panic attack. It may be on account of anxiety. It may be on account of obesity. Also, it may be on account of anemia also. So these are the various causative factors for dyspnea. So we have to identify the causative factor, whether it lies in heart, whether it lies in lungs, or it is a panic attack or some emotional upsets also. Anyway, these are some of the causes. And what are the dyspnea prime remedies or the first line remedies? It is no doubt about spongia, arsenic album, apis, lachesis, then china, and then calvicar, and of course aspidosperma also. So I repeat, for dyspnea we can think of spongia, arsenic album, apis mellifera, lachesis, then
Sorry, your voice cut touch. Suresh. Hello. Why suddenly voice cut? Anup sir? Hello? சார் வாய்ஸ் கேட்குதா? என் சைடில் ஒன்றுமே கேட்கறதில்ல. ரெக்கார்டிங் போயிடும். ரெக்கார்டிங் போகாது. கட் பண்ணிட்டுமா? எனக்கு ஒரு சவுண்டும் கேட்கறதில்ல. வைங்க, வைக்கிறேன். கொஞ்ச நேரத்தில் வரும்னு பார்க்குறேன். ஓகே. ఇది పోయింది వాయిస్. మళ్ళీ వాయిస్ అయితే సురేష్ కుమార్ చంపుతాడు. ఏం చేసినా
we have pulsatilla, we have gelsemium, we have ferrum phos, we have oxon, and ultimately
స్పీకర్
we have
ఉంటుంది. ఎప్పుడైనా అలా పోతే ఇది క్లిక్ చేయండి.
So these are some of the prime
ఏం లేదా
remedies
స్పీకర్ క్లిక్ చేయండి.
we
క్లిక్
can
చేస్తే
think of
శాంసంగ్లో ఉండకూడదు, హెడ్ ఫోన్స్లో ఉండకూడదు, స్పీకర్లో ఉండాలి.
various
శాంసంగ్ అనేది టీవీస్ ఉంటుంది, అది పని చేయట్లేదు. ఆల్రెడీ హెడ్ ఫోన్స్లో ఇంటికి వెళ్ళిపోయింది. స్పీకర్లో ఉంటేనే ఈ సౌండ్ వస్తుంది.
sulfur, pulsatilla, gelsemium, ferrum phos, oxon, and argentum nitricum. These are some of the first line remedies recommended or used in our clinical affection for eye affections. Then coming to last in alphabetic E is epistaxis. Epistaxis is what are the prime remedies for epistaxis? That is nasal bleeding from the nasal tract. So what are the prime remedies for epistaxis? So we can give first arnica. No doubt about this is the prime remedy. We can think of ferrum phos. We can think of ipecac. We can think of bryonia. We can think of phosphorus. We can think of nitric acid and ammonium chloride. So these are some of the prime remedies for epistaxis. Blood stains with the discharges or blood observed from nasal tract. So epistaxis is, we can think of these other remedies. Once again I repeat, arnica, ipecac, ferrum phos, phosphorus, nitric acid, ammonium chloride and bryonia. So for epistaxis these are the prime remedy. So we can always fall back on this type of first line of defense remedies. So with this I give a pause to my talk. We will continue with the more disease conditions in the next classes. Over to Dr. Murthy and Dr. Anu.
Is my voice audible? Hello?
Yes, sir.
My voice audible?
Yeah, it's audible, sir.
Okay. Namaste, my dear homeopaths. Thank you very much, Surinder sir and Anup Kumar and Suresh Kumar. Best lectures you have given today. Only one question I will ask. What are the 3 mother tinctures are available for IBP? What are the 3 mother tinctures are available for IBP? Anybody?
It is Raulfia, sir. Raulfia, sir.
Raulfia.
Yes.
Another thing? He himself has told now. Cratagas, Raulfia and Passiflora. When Anup Kumar is giving lecturing, he mentioned these 3 drugs. Cratagas, Raulfia and Passiflora. CRP. So okay, today time is over. We will meet next week.
Okay, sir.
Sound is also very less for me.
And I have a small question.
Yeah, please.
Sir, from the knowledge, on blood pressure and the dose, I would like to know some information and knowledge. There is a phenomenon called the oxygenate dose. This is called the shrinkage of arteries. You started, that night related homeopathy medicine.
Yeah.
Now there is a phenomenon of oxygenated blood, from the lungs going to the arteries, to the heart. If there is a shrinkage, they call it as the VAH, pulmonary arterial hypertension. Then the medicine, digitalis, can it also help?
It can help and the constriction. There are 2 medicines which we are discussing because of constriction of the arteries. that both can work.
It can.
Yeah. Digital is cactus and all can work.
Okay.
Namaste, Suresh Kumar sir. I have a small request.
Yes, madam.
Yeah, these notes we want, sir, especially ABC, or you are telling everything about all medicines and all. No? So we need notes so we can preserve that as an encyclopedia of Suresh Kumar.
Definitely, ma'am. I promise I am on the. Let me finish up the entire series of this therapeutic index, and we'll circulate you in detail completely. I promise.
Okay,
Yep.
thank you.
So thank you very much, sir. Thank you very much, sir. We'll close the session.